Melinda Gates, thank you so much for your time.
Thanks for having me.
The world is seeing an unprecedented crisis with the global pandemic of the COVID-19 coronavirus. Uh, First of all, what are your thoughts on what we are seeing right now?
Well, we're still seeing it on the rise in so many places around the world. And I think one of the things we need to recognize as a global community is that COVID-19 anywhere is COVID-19 everywhere. And we're just starting to see the effects on the most vulnerable parts of the population. And I have to be honest, that's the thing that keeps me up at night.
The Bill and Melinda Gates Foundation allocated $100 million to help the response with COVID 19, especially in South Asia and Africa. Let's talk about Africa and the priorities on the continent with regards to this fund in particular.
Yes. So, one of the things our foundation has been doing actually for the last couple of years is working to make sure that the African CDC is very strong so that there can be an African response. So, we continue to work with the African CDC. We are doing disease modeling very proactively to show as we get more and more data about how this disease spreads and who it affects the most in terms of vulnerable populations. We're putting that disease modeling information out there. And so we're trying then to take that to various countries like Southeast Asia, as you said, or many, many countries we're working with in Africa to say, here's what you need to do to prepare your health system for what's about to come. The other thing that we're doing is trying to make sure people understand that testing needs to happen for everyone, and it needs to happen in a very equitable way.
Massive testing is definitely one approach that experts are saying will be very critical on the continent. How much of the resources have been allocated, especially to testing, given that it's an important step when we talk about preparedness?
Yeah, so testing is fundamental. You have to know who's sick and who's not sick. And if you don't do testing and don't do contact tracing, you will get mass spread of this disease. And so, what we need to make sure is that testing kits are available, that they can be easy to use. And also, one of the things the foundation's been working on with the FDA here in the United States is working to show could we have a home test kit available? Then you could get them out very broadly across Africa. Because as you know, one of the things that's going to be very, very difficult for somebody who lives in a township or who lives in a refugee camp is to social distance. So the only tools we have right now are physical distancing and washing our hands. I've been in many African settings where people don't have running water to wash their hands. So we absolutely have to help people understand who has this disease and who doesn't, and how do we help them self-isolate so that it doesn't become a widespread infection throughout an entire region.
So practically, how do we help vulnerable population, children, pregnant women, even refugees and others? What can we do in this case with COVID-19 to help them?
What do? We make sure, first of all, that they're fed. People need to be able to have a meal and in every single day, they need to have food because if you don't start there, if people don't have access to food, they have to go out and find food, bring food into their home. We know it's something we all need. So one of the most important things we can do right now, I feel, is tell people we need to put money into making sure that people actually have access to food. Then we have to make sure that women know if they're pregnant, where can you go safely to still do your prenatal appointments? Where can you go to safely deliver that baby? Don't deliver at home. We have to help, practically speaking, the primary healthcare system separate out the patients who come in who have COVID from, say, patients who come in and are pregnant. That is fundamental in terms of having the healthcare system still work and support women who are pregnant. So those are two very practical examples.
Even though right now Africa has less cases of infection of COVID globally, but health experts are still warning that there is a big risk on the continent. What do you see as the priorities then moving forward?
I think there's an enormous risk on the continent. I think we could see an explosion of disease. And so the priorities have to be making sure people are fed, then testing and doing contact tracing. And then from there, making sure the people who can physically distance themselves. And then we need to make sure lots of protective gear gets out, this PPE that we're all talking about that healthcare workers wear, and masks, so that healthcare workers can protect themselves and can keep the health system up and running so that those who are sick can still come in and get what they need. So we need to do a lot of modeling too, some on good data to say this is where the resources should go. And I think here in the United States, one thing we can do is make sure that we're not saying, oh, well, only the protective gear is for the United States or for Europe. We have to make sure it's distributed en masse, equitably around the world. Otherwise, the most vulnerable are the ones who are going to lose the most in this disease.